as you all are aware that we have conducted one online exam regarding ECG. So now in this video we will see the answers for those questions. So you can see this video. So the first question is, a patient who is a known case of heart failure and he is on digoxin drug with complaints of shortness of breath has come to ED. The 12 lead ECG shows the following rhythm. Can you please identify this rhythm? This is the first question. So for this first question we have answers. First option is sinus bradycardia, second one is normal sinus rhythm, option C is first degree heart block, option D is complete heart block. So if you see in this ECG, so the answer for this one is complete heart block. So I will tell you. So here if you measure the distance between two P waves, it will be same, and if you measure the distance between two R waves, it will be same. That means atria is beating by its own. That means the activation of atria produces P wave and the activation of ventricle produces QRS complexes. We know that. So here atria is beating by its own, so that's why we get P wave, and the ventricle is beating by its own, so that's why we got QRS complex. But here there is no association between the P wave and QRS complex. So that's why it is called as complete heart block, and it is the one of the most dangerous thing. Okay, then we will go for the second question. So a 62-year-old male patient with lightheadedness and profuse sweating with chest pain has come to ED. The 12 lead ECG shows the following rhythm. Can you please identify the rhythm? This is the second question. If you see the answers, first one is anterior wall MI, second one is, that is B option, inferior wall MI, third option is lateral wall MI, fourth, that is D option, is complete heart block. So if you see here, a 62-year-old male patient presents with lightheadedness and profuse sweating with chest pain. So chest pain, this is the main problem for this patient. So after connecting the patient to the monitor, it is showing this rhythm. If you see here in the lead 2, lead 3 and AVF, so you are seeing ST segment elevations. So it is inferior wall MI. So 2, 3 AVF, these are all the inferior leads that will pick up the changes in the inferior portion of the heart. So as these elevations are there, so in the lead 2, lead 3 and AVF, we will call it as inferior wall MI, and we have to correlate with the cardiac enzymes. This is the second question. So the answer for the second question is B, that is inferior wall MI. Next we will move on to the third question. An 18-year-old male with palpitations has come to ED. The 12 lead ECG shows the following rhythm. Can you please identify the rhythm? So an 18-year-old male with palpitations. The answers is, first one is first option, that is option A is sinus bradycardia, option B is sinus tachycardia, option C is multifocal atrial tachycardia, option D is normal sinus rhythm. So if you see in the rhythm strip, that is lead 2, so usually we will see P waves prominently in the case of lead 2. So that's why we will take rhythm strip as the measurement of maybe if you want to measure the heart rate, everything and all, to detect any ischemias and all, we will be taking lead 2 as the rhythm strip. So if you see in this rhythm strip, here we are having a normal P wave, it's a normal PR interval, and QRS complex is also normal, and every P wave is followed by QRS complex and RR interval. Here if you see, if you count the distance between two R waves, it is same. So it is normal sinus rhythm. So when if you want to say the ECG is in normal sinus rhythm, you should have normal P wave. That means if you count the that is the P wave distance is, the height and width of the P wave should be less than 2.5 small squares in an ECG. Then you should have normal PR interval. If you count the normal PR interval, so what is first thing you have to know, what is the PR interval? PR interval, it will starts from the starting of P wave to the starting of this QRS complex. This is PR interval. So normal PR interval in an ECG, it is 3 to 5 small squares. Okay, 3 to 5 small squares. So if you want to say an ECG is in normal sinus rhythm, you should have normal P wave, normal PR interval, and you should have normal QRS complex, that is it should be 3 small squares. Then RR interval should be regular. If you count, see 1 2 3 4 1 2 3 4, for every 4 large boxes we are getting QRS complex like this. So and heart rate is also almost so we can calculate heart rate also. We can calculate heart rate in this ECG by 300 divided by number of large squares in between two QRS complexes, that is 1 2 3 4. So almost we will get 75 to 80, something like that. So that's why we are calling it as normal sinus rhythm. So the answer for this thing is normal sinus rhythm. That means you should have normal P wave followed by normal PR interval, and normal QRS complex and RR interval should be regular. So that's why we are calling it as normal sinus rhythm. Then let's move on to the fourth question. The fourth question is calculate the approximate heart rate. So here we have mentioned regarding the approximate heart rate. So there in this ECG, the third question also we have calculated the heart rate, but here we have especially mentioned the approximate heart rate of the following ECG, because sometimes it's very difficult for us to get the perfect heart rate, so we can go for an approximate heart rate. So this is irregular rhythm, so narrow complex irregular tachycardia. So if you see the QRS complex, it is narrow, that is less than 3 small squares, and if you count the distance between two R waves, it is irregular. See here distance is somewhat less, here it is too long. Then so if you see the distance between two R waves, it is irregular. So this ECG is narrow complex irregular tachycardia. So if we have a regular rhythm like this, as we have discussed in the case of third question, we can use this formula, that is 300 by number of large squares in between two R waves, that will give the approximate, that will give the heart rate in the case of regular rhythm. Whereas in the case of this irregular rhythm, so that formula won't be suitable here. We have to calculate the heart rate by using 6-second method. 6-second method, this is for calculating the heart rate in the patients who are having irregular rhythm. So this is narrow complex irregular rhythm. So we will see how to calculate this heart rate. So 6-second method, so we know that 5 large squares in an ECG, 5 large squares in an ECG will run at a speed of 1 second. That means 5 large squares is equal to 1 second. So like that we have to count the number of QRS complexes in 6 seconds. So now we will see. So 1 2 3 4 5. So 5 large squares is equal to 1 second. Now this is 1 second. 1 2 3 4 5. This is 1 more second. 1 2 3 4 5. 1 3 seconds. 1 2 3 4 5. 1 2 3 4 5. So like that you just count the number of QRS complexes in 6 seconds. That is, in 30 large squares you count how many QRS complexes are there, into 10 will give the heart rate. Here in this ECG almost 17 QRS complexes are there in between in a time period of 6 seconds. So multiply that 17 into 10 will give approximate heart rate, that is 170 beats per minute. I hope you are clear. So in the case, if you want to calculate the heart rate in the case of irregular rhythms, 6-second method is possible. We know that 5 large squares in an ECG, which is equal to 1 second. Like that you have to count the number of QRS complexes in 6 seconds and multiply that number of QRS complexes with 10, you will get an approximate heart rate. So next we will see this question. Fifth question: a woman sits in the surgical waiting room awaiting news about her husband's surgery when she suddenly becomes lightheaded, dizzy and nearly fainted. At that moment a 12-lead ECG was taken which is showing the following rhythm. Can you please identify the rhythm? So you will see this rhythm. The options for this one is option A is complete heart block, option B is first degree heart block, option C is second degree type 2 heart block, and option D is none. So here the answer is second degree type 2 heart block, or else we can call it as Mobitz type 2 heart block. So you will see why in the second degree type 2 heart block, if you see the distance between this PR interval, that is starting of this P wave to the starting of this QRS complex, it will be fixed. So the PR interval duration will be fixed, followed by the drop of 1 or 2 QRS complexes. Here you can see there is no QRS complex, here also you can see there is no QRS complex. So that's why this is second degree type 2 heart block, which is also called as Mobitz type 2 heart block. Okay. So the answer for this one is C, second degree type 2 heart block. Now we will move on to the sixth question. A patient with pulmonary hypertension came to ED with generalized weakness and breathing difficulty. The 12-lead ECG shows the following rhythm. Can you please identify this rhythm? This is the sixth question, and the options we are having is, the first option is right atrial enlargement, and option B is left atrial enlargement, option C is atrial flutter, option D is none of them. So usually the option is, this is right atrial enlargement. This is the option A is correct for this one. Why it is? You can see tall P waves here. So tall P waves you can see in the ECG. So usually P waves, where we have to see, as we have discussed earlier, P waves we have to see in lead 2, and V1 also we can see. Okay. Usually P waves in the case of lead 2 it will be dome shaped, whereas in the case of V1 it will be in biphasic shape. It will be in biphasic shape. Okay. But here you can see here tall P waves are there. As we have discussed, the normal P wave duration is the height and width of the P wave should end in less than 2.5 small squares. Here you can see this duration increased 1, 2, 3, 4. So this is tall P waves, which is called as P pulmonale. So that is an indication of that is also called as right atrial enlargement. So the option is sixth question option is A, right atrial enlargement, because of tall P waves. Then the second thing is, then next question 7th is, the rhythm identified by PR interval tends to become longer with every succeeding ECG complex until there is a P wave not followed by QRS complex. See, here we are saying PR interval tends to become longer with every succeeding ECG. Successively PR interval is prolonging. That's what it is there in that question. So then we have options. First A option is third degree atrioventricular block, B option is second degree atrioventricular block type 2, C option is second degree atrioventricular block type 1, and D option is first degree atrioventricular block. The answer for this one is second degree atrioventricular block type 1. This is C. Option for the 7th one option is C, because in the case of second degree heart block can be categorized into two types: second degree heart block type 1, second degree heart block type 2. So in the case of second degree heart block type 1, you can see progressive prolongation of PR interval followed by drop of one QRS complex. That is second degree heart block type 1. Whereas in the case of second degree heart block type 2, you can see the fixed PR interval followed by the drop of 2 or more QRS complexes. That is the difference between type 1 and type 2 second degree heart block. So here the answer for this question is second degree atrioventricular block type 1, C. Next, 8th question. A patient came to ED in an unresponsive state with no pulse, with no palpable pulse. After connecting the patient to the cardiac monitor, it is showing the following rhythm. Can you please identify the rhythm? So this is, so the answers for this thing is, first option A is sinus tachycardia, option B is white complex regular tachycardia, option C is wide complex irregular tachycardia. Option D is polymorphic irregular tachycardia. As all of you guys, you know it very well. So the option is B, wide complex irregular tachycardia. We'll also call it as monomorphic ventricular tachycardia, and this is wide complex regular tachycardia. So why we are telling it as wide? Because here if you count the distance, it will be greater than 3 small squares. So that's why it is wide complex. And the regular, if you see the RR interval, it will be coming in regular manner. So it is wide complex irregular tachycardia, because if you calculate the heart rate, so 300 by number of large squares in between two R waves. If you calculate the heart rate also, it will be almost around greater than 200, something like that it will be there. So it is wide complex irregular tachycardia or monomorphic ventricular tachycardia. That is the answer B for the 8th question. Let's move on to the 9th question. A 45-year-old businessman presents with feeling that his heart is racing. He also has some shortness of breath. This is his ECG. Present your findings and give a diagnosis. And the options for this 9th question is atrial fibrillation, multifocal atrial tachycardia, atrial flutter, and none of them. So the answer for this one is atrial fibrillation, A. So why it is atrial fibrillation? This is narrow complex. So because if you see the QRS complex duration, it is ending in less than 3 small squares. So that's why it is called as narrow complex. Irregular tachycardia it is, because if you see the distance between two R waves, it is changing. So it is narrow complex irregular tachycardia, and you can't able to see the P waves here. P waves are not seen here. So the narrow complex irregular tachycardia with absent P waves is atrial fibrillation. So the answer for this 9th question is A. Next, 10th. A 25-year-old man presents with a collapse which occurred as he was playing in a football match. He has suffered episodes of fainting in the past. This is his ECG. What is the diagnosis? Okay, the options are: first A, option A is WPW syndrome, option B is Brugada syndrome, option C is sinus bradycardia, option D is none. So here in each and every question we are telling you to tell about the diagnosis, so you have to make a note of it. So the answer for this 10th question is WPW syndrome, which is called as Wolff-Parkinson-White syndrome. So how can we recognize this Wolff-Parkinson-White syndrome is, as usual you take the rhythm strip. In that you can see the duration of the PR interval, it will be very less. That means shortened PR interval will be there. And you can see delta waves. So a shortened PR interval with delta wave will indicate Wolff-Parkinson's-White syndrome. I am not discussing regarding the causes and all, so we will just concentrate on the ECG findings. Then the 11th question is, so the 10th question answer is Wolff-Parkinson's-White syndrome, option A. Then 11th question, a patient with pulmonary hypertension has come to ED with generalized weakness. This is his ECG. What is the diagnosis? So if you suspect, most probably if you are already they have given it as pulmonary hypertension, you can think in terms of that mainly. The options for this one is 11th question. Options: first option A is LVH, left ventricular hypertrophy. Second, this one is sinus tachycardia. Option C is right ventricular hypertrophy, and option D is none. So the answer for this 11th one is right ventricular hypertrophy. So here we can see lot of ECG changes. So this ECG is in right axis deviation. You can see here in the lead one you can see negative waves, and in the case of AVF here you can see positive waves. So that's why it is right axis deviation. And in the case of here lead 1, V1, V2, V3, V4, you can see ST segment depressions along with T wave inversions. Okay, that is one finding. And you can see prominent R waves in the case of this V1, lead V1, you can see prominent R waves, and prominent S waves you can see in lead V6. So this is RVH criteria. So as with the pulmonary hypertension, we can come to a conclusion based on these findings. It is right ventricular hypertrophy. This is so the 11th question answer is C, right ventricular hypertrophy. Then 12th question, a patient with symptoms of muscle weakness and so here muscle weakness and acute renal failure was admitted in an ICU. This is his ECG. What is the diagnosis? As usual, you take the lead 2 as a rhythm strip and you can see, and the answer for this one is options. First option is atrial fibrillation, second option is hyperkalemia, third option C is hypokalemia, option D is multifocal atrial tachycardia. You can see here universal tall T waves. So P wave, Q, R, S, T. See here, see in each and everywhere you can see universal tall T waves, which is an indication of hyperkalemia. So if you found the universal tall T waves in an ECG, that is an indication of hyperkalemia, and already the patient is having the symptoms of muscle weakness and renal failure. So our diagnosis is hyperkalemia. So the 12th question answer is B, that is hyperkalemia. Then we will see the 13th question. A patient with pneumonia was admitted in the ICU. She was doing well initially but developed tachycardia while receiving albuterol for the ongoing wheezing. She was apparently normal with stable vital signs except increase in the heart rate. This is her ECG. What is your diagnosis? And the options for this 13th question is option A is atrial flutter, option B is multifocal atrial tachycardia, option C is supraventricular tachycardia, option D is atrial fibrillation. So the option for this one is supraventricular tachycardia. So why we are calling it as supraventricular tachycardia? So this is also narrow complex regular tachycardia with absent P waves. So usually if we have a tachycardia, it may be narrow or wide. In the narrow complex, so when we will say it as narrow complex tachycardia, if the QRS complex duration, if it is less than 3 small squares, then we can say it as narrow QRS complex tachycardia. In the narrow complex QRS tachycardia, we are having again two things, whether it is regular or irregular. Okay, so now you see this ECG is narrow complex already, so it is less than 3 small square, and it is regular also, because if you count the distance between two R waves, it is same. So that is narrow complex regular tachycardia, and you are not seeing any P waves also. So that's why it is supraventricular tachycardia. So the narrow complex regular tachycardia with P waves, you can get sinus tachycardia also, but here narrow complex or regular tachycardia with absent P waves is supraventricular tachycardia. Based on the patient's signs of stability and all, we can decide whether to go for pharmacological treatment or whether to control the heart rate and all. That can be decided as per the ACLS protocol and based on the clinical condition of the patient. So 13th question option is C, that is supraventricular tachycardia. Then how will you control the heart rate of the above patient? As an initial step in ACLS guidelines, please pick the appropriate first line pharmacological intervention that can be done to reduce the heart rate. Okay, so here the patient, now if you see the 13th question previous yearly, the patient is in supraventricular tachycardia. This is the ECG shows supraventricular tachycardia, but the patient is stable. Now we have to know, as per the ACLS guidelines, how to control the heart rate in a patient who is having supraventricular tachycardia, and here we have informed you to pick up the appropriate first line pharmacological intervention that can be done to reduce the heart rate. So we have discussed first, we are telling you to write the first line pharmacological intervention only. So usually if you want to reduce the heart rate, if you know that the patient is having narrow complex regular tachycardia with absent P waves, that means if you know clearly that the patient is in SVT, the first thing what you can do is you can go for carotid sinus massage or vagal maneuvers. That is first thing. If the patient is not if the rhythm is not reverting, the heart rate is not reducing with that, then we can go for the pharmacological treatment, that is adenosine. So adenosine 6 mg can be given, followed by 12 mg can be tried. Then we can go for beta blockers, calcium channel blockers and all. At last we can go for amiodarone also. So as per this this question, so here we have mentioned the first line pharmacological intervention, that is adenosine 6 mg. If the patient who is having central line already is in place, then no need of adenosine 6 mg, we can go for half of the dose, that is adenosine 3 mg can be given. So the answer for the 14th question is C, that is adenosine 6 mg. Okay. Then next 15th question is, so in the same, okay, next the 15th question is, a patient who has a known case of ischemic heart disease with atrial fibrillation has now been admitted in ED with complaints of dizziness and chest pain. Already you know that the patient might be having is a known case of atrial fibrillation. Okay, this is his ECG. What is the diagnosis? The first option is atrial fibrillation, second option is atrial fibrillation with complete heart block, third option C is normal sinus rhythm, option D is atrial fibrillation with first degree heart block. And the answer for this 15th question is atrial fibrillation with complete heart block. So already atrial fibrillation is there, and you can see here AV dissociation. Here also you can see in this AV dissociation can be noticed, that is atrioventricular dissociation has noticed in this ECG also. So it is atrial fibrillation with complete heart block. So the 15th question answer is B, atrial fibrillation with complete heart block. Then 16th question, a patient with respiratory failure has now been admitted in ED with symptoms of breathlessness and palpitations. This is his ECG. What is the diagnosis? So 16th question, option A is sinus tachycardia, option B is supraventricular tachycardia, option C is multifocal atrial tachycardia, option D is none. So the option for the 16th question option is C, that is multifocal atrial tachycardia. So why it is multifocal atrial tachycardia? So if you have a multifocal atrial tachycardia in your ECG paper, you should have more than 3 morphology of P waves, that is 3 different morphology of P waves you need to be there in that ECG. So that's why we will call it as multifocal atrial tachycardia. As we have discussed earlier, P waves usually it should be dome shaped in the case of lead 2 and biphasic, something like this in the case of lead V1. So in an ECG it should have, if you want to tell that ECG is in multifocal atrial tachycardia, it should be in either dome shape and this biphasic shape or some other slant shape, something like that can be there. If here you can see the P waves, so different morphology of P waves can be seen here. So that's why it is multifocal atrial tachycardia. But whatever it may be, our duty is to control the heart rate. Then 17th question, a patient with a known case of thyroid disease has now been admitted in ED with the symptoms of shortness of breath, abnormal tiredness, abnormal tiredness and confusion and weakness. This is his ECG. What is the diagnosis? So the options are, first option A is normal sinus rhythm, option B is first degree heart block, option C is sinus tachycardia, option D is none. So 17th option is first degree heart block. You just take the rhythm that is lead to as your rhythm strip, then you check about this thing. If you see in this ECG, you can see the PR interval. This is starting from P wave to the starting of this QRS complex. This is PR interval. Usually, as I discussed before, PR interval should be 3 to 5 small squares. 3 to 5 small squares in an ECG. If you count the number of QRS complexes, if you count the PR interval, so if here in this ECG it is greater than 5 small squares, so you can count here also, see. So that's why there is an prolongation of the PR interval, which is the first degree heart block. So prolonged PR interval is there, so that's why it is called as first degree heart block. But whatever it may be, the block and all as per ACLS guidelines. If the patient is symptomatic, that is, if the patient is having any signs of hypotension, heart failure, chest pain, signs of futures of shock, altered mental status, if any of these things are there, if the patient is symptomatic, then go for atropine, transvenous pacing. You can go for dopamine adrenaline infusions, transcutaneous pacing, that can be tried. But as per this ECG, the answer is B, first degree heart block. Okay. Then next one is 18th. This is the ECG of a patient with mitral stenosis. What is the diagnosis? So first one is option A is supraventricular tachycardia, option B is P mitral, option C is P pulmonale, option D is atrial fibrillation. So as per this ECG, the answer is P mitral. Okay, you can see here notched P waves here, like M-shaped P waves are there. That is P mitral, which is also called as left atrial enlargement. Left atrial enlargement or P mitral. So 18th question, option is B. 19th, a patient with chest pain was admitted to ED. Cardiac enzymes are elevated. Chest pain, main thing. Cardiac enzymes are elevated. This is ECG. What is the diagnosis? By seeing these things only, we can come to a conclusion that chest pain, cardiac enzymes are elevated. Most probably the patient will be in MI only. So the options for this 19th question is, first one is N-STEMI, non-ST segment elevation MI. Option B is sinus rhythm with STEMI. Option C is right bundle branch block. Option D is left bundle branch block. So you can see here the answer for this 19th question is sinus rhythm with ST segment elevation MI. So take the same lead 2 as your rhythm strip. You can see here normal P wave, normal PR interval, normal QRS complex, and RR interval is irregular, so it is normal sinus rhythm. And you can see elevations here. Okay, so this is sinus rhythm with STEMI. So 19th question, option is B, sinus rhythm with STEMI. Then we will go to the 20th question. A 62-year-old male patient come to ED in an unresponsive state with no pulse and breathing. After connecting the patient to the cardiac monitor, it is showing the following rhythm. Can you please identify this rhythm? So we have a 62-year-old male patient came to ED in an unresponsive state after no pulse and breathing. After connecting the patient to the cardiac monitor, it is showing the following rhythm. And the options for this question is, first one is option A is ventricular fibrillation, option B is polymorphic ventricular tachycardia, option C is atrial fibrillation, option D is none. Okay, we'll see this one is polymorphic ventricular tachycardia. So first, instead of telling whether it is polymorphic or monomorphic, here tachycardia is present. If you calculate the heart rate, it will be almost or greater than or equal to 100 only. So tachycardia is present. Whether it is narrow or wide means it is wide, because QRS complex is greater than 3 small squares. This is wide complex. Irregular tachycardia, this is not regular, it is regular. So we can have two options. Either it can be ventricular fibrillation or it can be polymorphic ventricular tachycardia. So it is not ventricular fibrillation. Why it is polymorphic ventricular tachycardia? Means here if you see this QRS complexes, it will be twisting around the axis, twisting over the point. So we can call it as polymorphic ventricular tachycardia or torsades de pointes. Torsades de pointes. So if you see this rhythm in the ECG, and apart from already pulse and breathing are absent, apart from managing the cardiac arrest protocols and all, we have to consider IV magnesium sulfate. IV magnesium sulfate 1 to 2 gram IV over a period of 5 to 10 minutes. So the 20th question option is polymorphic ventricular tachycardia or torsades de pointes. 20th answer is B. Next one, 21, which single statement regarding PR segment is true? So here you have to know certain things. So usually the ECG it will be like this. So P wave, QRS complex, QRS T. Okay, usually Q waves you won't see in ECG. If a Q wave is there, that's an indication of infarcted area. Now here we have mentioned regarding PR segment. So you should know what is the difference between PR interval and PR segment. So PR interval is starting from P wave to the QRS complex. This is called as PR interval. PR interval. So PR segment is this region. So this region only, this is PR segment. That is ending of P wave to the starting of this QRS complex. This is PR segment, and usually this PR segment should be in isoelectric line with the ST segment. Okay, this is the clarification that you should need. If this PR segment, usually it should be in isoelectric line with the ST segment. If it is elevated, then we will call it as ST segment elevation MI. If it is depressed, we can say it as non-ST segment elevation MI. So this is the thing. So if you go to this question, which single statement regarding PR segment is true? So first option is it commences at the end of P wave and ends at the QRS starting point. Second option B is it ends at the end of QRS complex. So this is wrong because we have discussed here. Then it represents the duration of the conduction of potential impulses from the AV node to the bundle branches and Purkinje fibers. So here we have discussed regarding PR segment. If we have told in this question regarding PR interval, then this option might be correct, because PR interval, it is the time taken by the impulse to travel from the sinoatrial node to atrioventricular node, that is your PR interval. But here we have discussed regarding PR segment, so this is wrong. So deviation can occur under any circumstances, that's okay. It is the interval between ventricular depolarization repolarization. So this is the first option. So 21 option A is correct, because it commences at the end of P wave. This is P wave at the end of P wave and ends at the starting of QRS complex here. So that is called as PR segment. Okay. So 21st question, option A is correct. Then we will see 22nd question. Which single statement regarding ST segment is false? So they are true, here false. It commences at J point, option A. Option B is it is isoelectric under normal circumstances. Option C is it ends at the end of T wave. And option D is the ventricles are contracted during the ST segment. So false, this thing is option C. It ends at the end of T wave, that is false, because ST segment is it where it is what they have mentioned is it ends at the end of T wave. It is not like that, it ends at the starting of T wave. So that's why this is called as ST segment. Okay, so the false statement is C. So 22nd option is C. Now move on to the 23rd. A patient who is a known case of hypertension and thyroid disease has now been admitted in ED. Hypertension and thyroid disease has now been admitted in ED for chest discomfort. This is ECG. Can you please identify the rhythm? So options are trigeminy. First option A is trigeminy, option B is complete heart block, option C bigeminy, and option D is none. So as usual, you take lead 2 as your rhythm strip, and you can see here the option for this, the correct option for this 23rd is C, that is bigeminy. So bigeminy, so the thing here you can see in this thing, so every normal sinus beat, every normal beat followed by an abnormal or irregular beat, that is an ectopic here. There is also an ectopic here. So one sinus beat will be coming, and along with that one irregular and ectopic beat will be coming, and if you see this thing, they will be looking like twins. So that's why we are calling it as this condition as bigeminy. So 23rd option is C, that is bigeminy. 24th, a patient with known case of CAD, coronary artery disease, with complaints of chest pain and shortness of breath has come to ED. Most probably if the patient is having chest pain, think in terms of MI. drop pi is already elevated, so most probably the patient will be in MI only. What is your diagnosis? So LBBB with myocardial infarction. Second option B is first degree AV block. Option C is anterior wall MI with RBBB, and option D is inferior wall MI. So the 24th option is C, that is anterior wall MI with RBBB. So anterior wall MI, you can see here V3, V4, V5, V6, you have ST segment elevations. Along with that, you can see here RSR pattern. So here you can observe RSR dash pattern, so which is an indication of right bundle branch block. So 24th question answer is C, that is anterior wall MI with RBBB, because you can see elevations in V3, V4, V5, V6. So anterior wall MI with right bundle branch block, you can see RSR dash pattern also. Then 25th question, which best describes this rhythm? First one is WPW syndrome, Wolff-Parkinson-White syndrome, that is option A. Option B is Brugada syndrome. Option C is anterior wall MI. Option D is none. So 25th option is Brugada syndrome. Okay, you can see ST segment elevation in V1 to V3, V1 to V3. These ST segment elevations are also greater than 2 mm, and you can see T wave inversions also here. So that is an indication of this ECG shows Brugada syndrome. 25th question, option is B, that is Brugada syndrome. So with this thing, we have completed this video by explaining the answers. I have explained something related to this thing, and if you want to check the answers, here we have given the answers also. You can go through that answers. Thank you.